Thank you for joining us for a very special series. I will be highlighting the power of metabolic health in the employee wellness space in this series of multiple episodes. We're going to be demonstrating the power of nutrition and community in improving the lives of employees in the corporate landscape. Our employee wellness program has been published in the medical literature. We've demonstrated a reduction in cardiovascular risk, a reduction in A1C, blood pressure, and weight, all while reducing the burden of medications. Despite these amazing results in the literature, they don't capture the patient experience. Today, we're going to be bringing you those stories. In a world where a healthy and happy workforce is essential, Laitram and Intralux is leading the way in employee well-being. Welcome back to our Employee Wellness series, where we've been sharing with you the stories from Laitram's leadership and their employees who've trusted us to improve their lives. Today, we're going to be bringing you the story of Frank LaBiche, whose commitment for the past 20 years as HR director has been to improve the health and wellness of his employees. Today, we're going to talk about how Frank approached our practice so that we could help him bring metabolic health to his workforce and to his employee landscape. We really hope you enjoy this episode.
The Louisiana company that invented a machine to process shrimp back in 1947 is leading the way in employee wellness and healthcare. I talked with Dr. Tro Kalajian of Dr. Tro's Weight Loss about what Laitram provides its employees.
We work with, all the different businesses there because it's not just that company. You have to sort of give people the tools so that they can sustain this at home.
Meeting health needs of workers.
We want to bring your services to the entire company. And so that was exciting to me because I know in the literature it's been published that a metabolic health program focused on nutrition, focused on low-carb eating, intermittent fasting, it's been shown to save companies money. It's been shown to reduce the costs for medications, and patients absolutely love it because they lose weight and they come off their diabetes medications. So I was excited. I want to welcome extra special guest, somebody I've worked with over the past 2 years on this metabolic health program. It's Frank LaBiche. He is the Director of Human Resources at Laitram, Intralux, and we are so happy to have him here. He's been at this company for 28 years and 9 years as a Director of HR. Just happy to have you here.
Glad to be here. Thanks.
So can you talk a little bit about, you guys are 5,000 employees in multiple countries, and you're a self-insured company. Can you talk a little bit about being aligned as a company with your employees' health and being aligned with their health outcomes?
Yeah, of course. So obviously, since we are self-insured, we all have a stake in the outcome of how the health plan works relative to, our premiums and then what we spend. So everybody in the company on the plan should have a vested interest in, obviously, their health, which impacts the health plan overall. So, Tro, back in, I think it was 2010, 11, we were really seeing a great amount of spend year over year increasing. And we really started to take a more proactive approach to how we approach healthcare and wellness, and really trying to get our employees engaged in their health and well-being long term in order to start hopefully bending that curve or even flattening it out over time. And since that time, it's evolved into a very large program, which we think has been very beneficial in that respect, but also has had a number of great other outcomes in addition to just the annual spend.
Can you talk a little bit about that, all the different approaches? Because we've been contacted by a number of different employers of all sizes, and something struck me about you in comparison to those was how many different programs and how committed you guys were to your employee health. It's really a culture that I don't think many other companies that we've talked to have created as successfully as you have. Can you give people an idea of what your employees have access to in this effort to help them get healthy, help reduce costs, this culture of wellness you guys have created?
Absolutely. So, when we started back in 2012, it was a small initiative. We opened up an on-site health clinic with one part-time nurse practitioner and a medical assistant. And one of the things we were trying to obviously impact was cost. But the thing that we really didn't understand that would happen is really the productivity gains that we've achieved through this program, not only for the company, but for the individual employee and their families. And what it's become now is more an effort on what I like to term, how do we reduce or eliminate barriers to access to medical care and other treatments or services that employees are looking for. So since that time, with that kind of vision with the program, we've expanded to add a number of additional services. So now we have an on-site PT, we have on-site behavioral health, we have an on-site pharmacy, fitness center, along with trainers that employees can access. So we've continued to add on to the program each year as we saw opportunities to really eliminate any barriers to access. And one of those is people taking the time to go see a provider or, access a service. Is it available to them readily? What is the cost? How can we reduce or eliminate any barriers that would really prevent them from taking control and getting engaged in their health and well-being?
I know you guys have done Weight Watchers before. I know you've done other programs before. And I'm always curious. I don't even know the answer to this. What was your initial goal when you reached out to our clinic? What were you hoping to get out of bringing sort of metabolic health to your employees? What was the thought process here? Because you have incredible services there that most companies don't have. So what were you thinking that we would offer? This was almost 2 years ago, maybe even more than 2 years ago. What were you thinking would happen? What were you hoping would happen?
When we look at the services we offer, and you and I have had this discussion along with Amy, obviously, about everything I think is at the individual level. Different programs, be it Weight Watchers or, other diets, the Mediterranean diet, whatever it may be, it's really at the individual level. And what we find with employees is that a lot of people want to do better. They want to get engaged, but they don't know how. And sometimes they just need a hand to really lead them down that path to get better. And I think what we're seeing is that in the traditional space of nutrition and diets, that some folks were definitely impacted and being helped in those particular areas. But then we weren't seeing this void in the, in your area, the metabolic health, the low carb type space. And we really wanted to offer individuals, not only employees, but their dependents, the opportunity to understand what this could do for them. What is another option for them to consider if they were having issues or they were reaching plateaus or weren't able to achieve their goals? There's other resources and other ways to do things. And this was a great opportunity when we were introduced to you and your team to say, hey, this is something else you need to consider in the whole spectrum of well-being and weight loss, addressing diabetes and things of that nature.
Those HR directors that are listening into this, or the CEOs that are listening into this, as a doctor, and Amy, tell me if I'm wrong here, as a health coach, our goal is the person in front of us. You guys sell huge manufacturing equipment to the biggest companies in the world. I'm sure when you make a big contract, there's some bell somebody rings. And when we get people to reverse obesity and reverse diabetes, there's a bell we ring. I want to understand, as an HR director, when you're setting up programs like this, what metrics are you paying attention to? Is it the engagement of the employees? Is it the outcomes? Is it drug cost savings? Is it work days lost? So how do you evaluate a program like this to see if it's the right fit for your company?
I would think there's a little of all of that you mentioned in that evaluation. Sometimes it's hard to correlate outcomes to a particular program. I know everybody wants to do that correlation, but sometimes it's difficult to do. You think about the workers' comp space. We're going to implement an ergonomic program. Sometimes it's hard to correlate. Did you actually impact your worker comp costs over time? So it's not always easy to say, oh yeah, we're going to do that and we're going to expect this to occur. But with this program, what your team is doing though is put in this remote monitoring and this real-time measurement. So we're really able to actually capture the outcomes for each individual and really see the impact that the program is having on those individuals. And with that, we've seen, and I know that y'all have all seen this, not only with our employees and their families, but other patients. It's just, obviously there's costs that occur with this. You get off specific meds, diabetes, whatever it may be, but also we're just seeing a whole change in these individuals' view of what they can do and their productivity and just their general outlook on life and how much happy they are in their new situation. And since they've lost maybe 50 pounds, 70 pounds, or whatever it may be, they're off the diabetes medicine. So they're able to bring their A game every day to work, to where they may not been able to do that before and not be as productive and happy, not only in work, but also in life, which obviously translates between the two.
You said that it's difficult to quantify that kind of productivity. But just anecdotally, what have you heard from the people that work for you, that work for Laitram, in terms of their quality of life, in terms of the improvements in the quality of their families' lives, people that aren't even maybe in the program, that just have access to the app? What have you been hearing?
Absolutely. I hear from folks all the time. They'll send me an email or I'll see them in the hall, and they just rave about the program that we're doing with Tro and the team, and how not only with work, but just their ability to go on vacations, to be more engaged with their families. And that all translates into work, because obviously we're providing this benefit. It's set them on a path that maybe they wanted to go down, but really didn't know how to do it. Or they had gone down a path and they reached a certain plateau, and it's like, all right, then I'm stuck. What do I do now? But now we put them on a different path and they said, oh, well, this is working better, or it's maybe moved past that plateau I was on before. And we see that with a number of our programs. Our behavioral health, since we started offering behavioral health, those counselors, they actually have a backlog of up to a month at a time, which we're trying to address. But having that resource, not having to spend the money to go to that, to get that resource, which in New Orleans, like many large cities, there's not a lot of providers. A lot of them don't take insurance. The hours, particularly for our production workers, are very difficult for them to reach those resources. So, each one of these eliminates those barriers to access, which, makes these individuals much happier, both in life and at work. I hear it all the time, not only with y'all's program, of course, but with a lot of the services that we offer, that people can get on the right path to get the help and get engaged like they want to.
The access to care in Louisiana is something we should probably talk about. I've been interacting with doctors from Ochsner and Toro and other institutions down there. And, we've been working with them in caring for these people. You care about their metabolic health, these 150 or so employees that are in this program, but you find things that maybe another doctor or just having another set of eyes helps with. There was a case of parathyroid cancer we diagnosed. There was a case of an adrenal cancer we diagnosed. There was a case of a heart disease that wasn't known, sleep apnea. And these doctors, when we talk to them and call them, coordinate care with them, luckily everything was early enough that something was able to be done before anything bad was found. The amount of gratitude we got from those doctors was surprising. A lot of times you don't know what to expect. And they echoed exactly what you just echoed. Yesterday, I just talked to a patient's doctor who said, I don't know what we would have done without you. And when I heard that, I said to myself, man, I'm doing my job. I'm definitely doing my job. One of the last questions I have for you is, you guys have taken it a step beyond, not just providing sort of metabolic care to really those who need it. You guys have decided to give continuous glucose monitors and ketone meters at a steep discount to anybody in the company. And this has not been done anywhere else in the country. So what was the thinking behind that?
I think we've talked about is, we know that food impacts us all differently. What impacts me one way is going to impact Amy differently, going to impact you differently. And no one really knows that. And the only way to know it is to really measure it in real time. And with your program, y'all been able to do that. And, you see people's glucose levels spiking. Y'all are on the phone, you're texting, hey, what's going on? What did you do? Let's look at that. And now individuals just want to know, I want to lose 20 pounds, or I just want to improve the way I eat. And how is the food impacting me? Now we can give them the glucose monitors and they can do that themselves in real time. So as you know, I wore mine for 2 weeks and I was amazed at the different things. I thought that should be healthier or healthy. And it's like, I spiked because it's got a hidden sugar in there I didn't know about, because I don't know what the hell the damn definition means. On the label, counsel me, say, well, that's a hidden sugar in there. So you don't know all this. You think you're eating healthy. You think things are going great, but you're spiking your glucose levels up and down and not knowing what's going on. So as we know, knowledge is power. And so those glucose monitors provide that knowledge to folks so they can really make the adjustments to figure out, hey, that food is not good for me. It really impacts me differently than it would, say, Amy. Amy may eat in it, no impact, but for me, it really spikes me, my glucose, and I need to cut that out.
I have to be honest, our culture is the same exact as yours. We're big believers in patient empowerment, giving patients tools, giving patients feedback so that they know, why should they trust me? We want to give them the tools so that they don't have to trust me. You can look at your own blood sugar meter. You can look at your own lipid panels at 0, 3, 6, 12 months. Is your health getting better? You be the judge. We're going to give you the tools to sort of help figure that out. We're just so proud to work alongside all the services you guys offer, and especially grateful. I think you guys took a little bit of a chance on us when we started this pilot program. program, and I'm just so glad it's worked out so well.
I am so impressed by this company that, first of all, every person that we have worked with, and it's been many at this point, has been there many, many, many years, but also like the commitment to metabolic wellness. That is a shift that it's hard to get across, even on the dietary guidelines at a government level. And yet you guys, especially just your commitment to the CGM, your commitment to our program, it's an enlightenment that you don't see in many places. And you are putting so much of your resources to helping people in that way. It's really impressive. So
Oh,
thank you.
I appreciate it.
Any advice for an HR director out there with 2,000 employees, 3,000 employees, 5,000 employees, getting started with metabolic health and putting these programs into place? Any advice for them on where to start, where you did your due diligence?
I know sometimes for small organizations, it's difficult. For some of these programs, for the scale purposes, it's hard to do. But I know for this area, for metabolic health and weight loss, I think there's a lot of opportunities that they can even pursue through the health plan, through the resources there. Really engage those resources, understand what can be accomplished, what's available, what's the normal. We don't want to do just the normal. We want to be able to provide a better education to our folks, understand what the options are for individuals that are having issues, either diabetes or otherwise want to lose weight, really provide the resources and education that they need to really get engaged in their own and make their own path. I understand all companies can't do what we do from a resource level, but almost every company is fully insured or self-insured. There are resources there they can tap into to get a program off the ground like this.
And I think the beauty of what the Society of Metabolic Health Practitioners has shown with a latest publication is there's 3 groups around the country, in the West Coast, in the UK, and now in New York and Louisiana, that employee wellness programs systematically in the literature have reduced costs, and prescription drug costs are the most tangible ones. So
Yeah,
I'm going to echo that.
Definitely, almost every health plan, particularly in the South, diabetes is a driver, a lot of costs, obesity, and really changing behavior is the biggest way to change those outcomes. And that's through education and making sure people understand what their options are and what they can do to take control of their own health.
Thank you so much, Frank LaBiche.
Anytime. Thank y'all very much.
Thank you so much for listening to our Employee Wellness series. We hope you find it interesting and inspirational. If you're interested in bringing metabolic health to your work environment, to your company, please visit drtro.com or reach out to our practice.